Good afternoon, ladies and gentlemen. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Jessie Checkley, Director of CSHI. Please go ahead.
Thank you. Hello and welcome to today's extra Cohort 14 informational webinar. As mentioned, I'm Jessie Checkley, Director for Building Capacity for Improvement and Transformation at CFHI, and I'm pleased to be your host today. During our webinar today, we'll be sharing information about the 2018-19 Extra program, and we'll be answering any questions you may have. We're pleased to have more than 40 participants from coast to coast to coast. As you can see, we have a map up on our screen, and if you'd like to include information about where you are, please feel free to add that to our map. As I introduce our speakers, please take a moment to introduce yourselves using the chat box on your screen, and also please take a moment to let us know how many people are attending from your location, including yourself, using our poll in the center box on the screen. We're so pleased to have 3 extra fellows on today's call. Jennifer Goodwin is the Vice President of Communications and Public Engagement at Interior Health in British Columbia. In her role at Interior Health, Jen is focused on enhancing relationships with Interior Health's many stakeholders and supporting the delivery of quality health services. Jen provides leadership and support in the areas of corporate communication, media relations, and public engagement. Before coming to Interior Health, Jen worked for 10 years at Providence Care in southeastern Ontario, where she held the position of Vice President Community Partnerships and Chief Communications Officer. Jen developed and implemented the communication strategy for a recently completed multi-site consolidation and hospital construction project. Danielle Paré is the Chief Executive Officer of the Centre Intégré de Santé et des Services Sociaux de Chaudière-Appalaches. Mr. Paré sits on the boards of several organizations and events. Over the course of his career, Mr. Paré has always been dedicated to improving quality of health services and has also been involved in research on population-based responsibility in Quebec. Patty O'Connor is Extra's Curriculum and Faculty Coordinator. Patty is a registered nurse, holds a Master of Science in Nursing, is a certified health executive, and has completed fellowships with CFHI's Extra program, the U.S. Commonwealth Fund's Harkness program, and the Canadian College of Health Leaders. Patty works as an independent consultant and is also an assistant professor for the Ingham School of Nursing at McGill University. She has over 40 years' experience in healthcare, including 13 at the executive level. As the former Chief Nursing Officer at McGill, she has led innovations in partnering with patients and frontline staff to co-design improvements in care delivery, recognized as leading practices by Accreditation Canada. In the room with me at CFHI in Ottawa, we have our producers, Sheena Powell and Kelly Ripley, and from our extra team, Kristen Kern and Jessica Fournier. On today's call, we'll begin to discuss the basics and introduction to the Extra program. You'll hear about the Extra experiences from Jen and Danielle. Patty will speak to the curriculum and highlight the expertise and support offered to the Extra fellows through the faculty and coaches. We'll provide an overview of the application process and give you more information about how to assess your organization's readiness to lead improvement through the Extra program. For those who may not be familiar, the Canadian Foundation for Healthcare Improvement is a not-for-profit health improvement organization funded by Health Canada and dedicated to accelerating healthcare improvement by building leadership and skill capacity to champion and lead improvement, enabling patient, family, and community engagement, and involving those who experience and need care as experts in making and co-designing improvements, applying improvement tools and methods to drive measurable results toward better care, better health, and better value, and creating collaborations to spread evidence-informed improvement across Canada, and bettering the health of populations. One of the ways in which CFHI supports organizations to achieve the above is through the Extra Executive Training Program. CFHI's Extra program is a 14-month Pan-Canadian Quality Improvement and Leadership Fellowship. Extra supports teams of senior health leaders as they design, implement, and evaluate evidence-informed solutions in their organization. Extra aims to enhance the capacity of leaders and teams to make change happen, build the capacity of organizations to achieve and sustain improvements, create a pan-Canadian community of leaders dedicated to innovation, and accelerate sustainable design, implementation, and evaluation of evidence-informed improvement projects that are critical to strategic priorities of the organizations involved. Organizations select a quality improvement project and identify a team of 3 or 4 senior health leaders known in the program as fellows. Working in teams and guided by CFHI faculty and coaches, fellows apply the knowledge and skills they learn to design, implement, and evaluate breakthrough innovations and create the conditions for sustainability and spread. Renowned Canadian and international faculty deliver the extra curriculum with support from CFHI coaches and staff. The curriculum is guided by CFHI's 6 levers for healthcare improvement and is delivered through 4 in-person residency sessions, a series of interactive webinars, and our online learning platform. There is no particular theme for Cohort 14. Improvement projects should be driven by the priorities of your organization and should reflect the change you want to see happen. The cost for participating in Extra is $5,000 per fellow. More than 100 of the 373 fellows are now working at senior executive level in organizations across Canada. Many of the improvement projects have resulted in meaningful improvement in the fellows' organizations, regions, and even spread across the country. Some examples include a team within the University Health Network in Toronto who reduced preventable emergency room visits by 57% at a long-term care facility. If this initiative was implemented nationally, it could save $22.5 million to the healthcare system. Also, a team from Eastern Health in Newfoundland and Labrador reduced wait times for orthopedic services by 45%. In fact, several of the extra projects have gone on to become CFHI spread collaboratives, including the Appropriate Prescribing Collaboration, which is a current program of CFHI. As you can see, organizations and teams in Extra are producing real results. Now we'd like to pass things over to learn a little bit more about the Extra Fellow experience. So let me pass the microphone to Jen Goodwin, who is a Cohort 12 Extra graduate. Go ahead, Jen.
Thank you, and hello, everyone. Thank you for the opportunity to share a bit of my experience with you today. We'll just go to the next slide, please. So I wanted to talk a little bit, knowing that many of you are thinking about applying, about some of the things that you can be thinking about as you're putting your application together, which the application itself is a significant amount of work, but helpful in terms of getting your thinking ready for the program and really setting yourselves up to get the most out of the program. I think really critical is that you're looking at areas in your organization that are already a quality problem on your work plan or agenda. It needs to be something that is already connected to strategies and overarching priorities that your organization is focused on. Examples being around access and flow or primary care transformation, capacity, and long-term care. Those are types of things, if you're already addressing it, then the opportunity to be considering what might be suitable for Extra and for the team's project fits well within that. Also important to be thinking about why the challenge is important to your community and to patients and families that organizations serve. Again, from the patient perspective, some of the topics may be around access to services or wait times, as we heard some of the examples. Segregation is another one that in our cohort showed up a few times. So really, those are starting places, is to be having a bit of an idea of what's important to your organization and what's important community, because for the success of both your application and then of your project, it needs to be something that matters already. And that's also part of what's exciting about the program, is because then the teams that are working on it, you get a real sense of working on something important and something valuable, and that has benefit both to the system but to the individuals who get to participate as well. Really critical also early on in the process, I know for our team, was that we actually had buy-in from 4 CEOs of our organizations in Kingston, as our group was a collaboration between organizations. And that CEO leadership, that senior team leadership, is critical, even at the application stage. There is a role for participation of CEOs and leaders in the program, even if they're not members of the core. So that's something right up front that if you're thinking about applying, really important to have that conversation with your boss, with your CEO, to make sure that that buy-in and that support is there. Participating in extra, it is over 18 months, but there are chunks of time that you need to be able to invest in right away. And I know even in the application phase, our group was starting to meet on a weekly basis, and we actually did through the entire program. Our core team met for about 2.5 hours a week, every week that the program was going on. So there is a time investment as well as the financial investment, and that's again why the support from leadership is so important. I also wanted to spend a few minutes talking about, as you're thinking about your team selection, because that's also a key part of thinking about your application and going forward with this commitment. There's sort of 2 teams you need to be thinking about. The first being that core team, which is 3 to 4 people, as mentioned. And that doesn't necessarily, our experience was we weren't a team that had ever worked before together. So we were 4 individuals who were literally meeting each other for the first time as we put our application together. And we had a physician as well as a senior leader at the acute care hospital in Kingston, Kingston General, a senior leader at our local CCAC, and myself, I was a senior leader at our non-acute hospital provider. And we were sort of different roles, and myself being from communications was not, I wasn't one of the people that normally gets nominated for QI type programs. And so I'd also challenge you to think for that small group, it doesn't have to be the same people who normally do quality work, or who normally work on improvement projects like this. Or who have this role in the organization. Be creative about your small team, because bringing somebody in from one of the other areas of the organization, as long as there's a connection to the project or a skill set that they can bring to the core team, it's a value add. And it's actually a way that you can spread quality and engage capacity within your organization. So that's something to keep in mind about the core team that participates. And then with the broader group, what I'd suggest is that it's really beneficial if the steering committee that's going to have oversight of the project already exists, is already formed as a group. In our experience, we actually had to bring a group together because this was a collaborative project. And while the group that came together ended up being a bit of a basis for an ongoing steering committee as we moved on, and there's life to it now, so there was a benefit that way, it was challenging in the early stages of our project because our steering committee hadn't worked together. And so we had to go through some group norms at that level as well as at the core team level. And I think that caused some challenges and made it a little bit more difficult for our group. So as you're putting the applications together, those are 4 things to think about. We can go to the next slide, please. So just a few minutes, I thought I could illustrate some of what I just said by telling you a little bit about the project that we worked on. As was mentioned, I was working in Kingston at the time, and our team is from Kingston. Myself, again, from Providence Care, and we had the participation of Kingston General Hospital, CCAC, and the Division of Family Medicine at Queen's University participating. So 4 organizations, and that's something, again, challenge yourselves to thinking whether your project is one that is legitimately within your organization and supported within, or whether there's opportunity to build some relationship and partnership with another provider organization in your community. We knew going into the program, we as a local area wanted to do some work strengthening both access and experience of palliative for residents and families in Kingston. And so we knew that was our problem area. Had many different ideas of what our aim statement could be. So for the application, we did craft an aim statement. It is not what our aim statement was on the poster presentation at the end of the program 18 months later. So it definitely did evolve. So it's good that while you're going through the application and while you're preparing, you're thinking about what your problem and what your aim statements will be. But don't be concerned that that's something you now have to live with for the next 2 years. It is something that is an process, and you get lots of support in the program for developing that. So we really narrowed our focus as the program went on as we were participating, and with the input of providers across all the organizations and other providers in the community as well, and very much input of some of our patient partners and family partners and advisors who were working through the project as well. Our project ended up being about care coordination and transition with a focus on improving the experience of patients and families who transitioned from clinic-based care at the cancer center to receiving palliative care in their home at the end of life. And as we went, you can see that we had great experience using tools and learning different ways of measuring and presenting measurement, and also then where we really built in the experience of the program, what it helps you achieve is really thinking about how what you're doing could be spread and sustained going forward. You really start thinking about that very early on in the project planning. So that really helps you keep that future focus while you're actually working on the more narrow and immediate work of your project. I think that's really a key part of the extra program, is learning how to think ahead while you're also thinking in the present moment. And then obviously the other key component throughout the program is engaging with patients and families and really co-creating what the innovations might be and what you test and how you implement them. One of the key messages that our team really took away was that it's about small changes, lots and lots of small changes. It's not a big bang. You have opportunities to make tweaks all the way through, and that continue to apply today. If we can go to the next slide, please. So really in a nutshell, the program experience and the benefit and why I would absolutely encourage people to consider applying and how it might fit within your organization is there's a very practical upfront benefit where the core team participants absolutely get exposure to and frameworks and models and tools that you can apply in many different ways. It's a great professional development opportunity to be engaging your academic brain at the same time as applying it to real problems, real situations. You have amazing exposure to healthcare leaders and innovators who've got this huge wealth of experience and different examples and ideas that they've implemented and where they've learned. So that's a very big benefit as well. The benefit of having a coach throughout the program to work with you on your project is incredible and something that we don't often have in healthcare, where we're working at such a fast pace most of the time. It's really helpful to have those opportunities built into this program where you are reflecting and considering how you might do things differently. And I've mentioned tackling a real problem with as part of the project, that this isn't an add-on, it's something that you're doing as part of your real work. It's also a benefit for folks who are in leadership to be able to interact with staff at all levels of the organization, and certainly being able to connect with and meet people that you don't normally see in your day-to-day work helps you as a leader in the organization as well, and helps position you for different audiences that maybe you haven't engaged with as well. For myself, it was certainly working with physicians and working with community physicians. It was a group I hadn't worked with before, and those relationships were really valuable and to be valuable as we went through the program. And of course, working with the patient partners, also really great experience. And I just underscore again that as somebody who wasn't normally the one tapped on the shoulder to do quality improvement work, it was an incredible development experience for me as well, to be able to bring a different skill set to the table with some of the clinical leaders on our core team, and to be able to contribute in that way. So that, I think, was a strength of the program also. And we'll just go to my last slide, please. So 3 things that why it was worth it and why it's worth putting everything you have into the application and really looking at this as a great opportunity. You know, it contributed in our organization. The extra program was something that I learned a lot out of related to quality improvement, related to engagement, and I then brought back to our organization and was able to help spread that capacity. Today in my new role in BC, I'm also able to be an active contributor at our senior table on our quality planning and our quality review and those of pieces of work where maybe I wasn't as well positioned previously, just had a different educational background and different experience. This has contributed to my ability to be a senior leader in our organization today. It's also contributing to how I'm able to look at projects that we're doing now. One example that I really get at Extra with is we're looking at the opioid crisis in British Columbia and overdoses and its emergency where it's challenging health services providers because we need to target clients who are using drugs at home and alone, and that's a really interesting client population to try to engage because usually it's done in private, and these aren't people that you can catch in the same way that we may be able to engage with other patient populations, say cancer patients at a cancer center, for example. So skills that I learned in Extra in terms of leveraging other tools, whether it's social media or working with partners who maybe we don't normally work with in healthcare, thinking outside the box a little bit like that, I'm able to apply to this project now and really take a leadership role in developing strategies and trying again in that incremental change way how to reach this population, to understand and get feedback and input from them about what services are needed and where best to locate services, how best to deliver services that can address the health crisis we're facing. So that's just an example of how Extra continues to impact my leadership today. And I'd say, and I put the picture of the skiing there, and the group from Extra will know that this was a big deal for me, but the Extra program comes with, you meet a huge range of people from across the country, and you get to travel once or twice through the program to their in-person residencies, and those are such valuable experiences, both for building your own network, but also for trying new things outside of work. For me, it was I learned how to downhill ski, and I conquered my fear of going up 3 chairlifts at Blackcomb Mountain and then skiing downhill, and it really just as professionally, you know, we take risks all the time, and doing things like applying for Extra, looking at the program and saying, wow, this is a huge commitment, can I really do it? It's like going to the top of the mountain. You know, you just do it, and you learn from it, and you may not be successful the first time, you may fall the first time, but you really build your leadership capacity and ability to tackle new challenges going forward. And that was something that came out of Extra for me personally as well, was the confidence of knowing I could work on a project that was absolutely focused on patient care, family experience, and I could make valuable contributions, but I could also learn from it and really carry that forward in my journey now. As I continue in healthcare. So those are some of the pieces of feedback from my experience in Cohort 12, and I'll pass it back to the facilitator.
Thank you, Jen. I think that was a terrific demonstration of both the personal and professional aspects that Extra brings to those who participate. We'd now like to invite Daniel Paris, a fellow from the current cohort, to tell us a little bit about his experience. Just a note for our English-speaking audience, you'll be hearing the voice of our translator, and you may hear a slight delay. Please go ahead, Daniel.
Hello. I'm very happy to share my experience, currently underway, might I add, because our team, and my team is in Cohort 13. We are currently going through the program. So I'm the CEO of my organization, and I'll be speaking as a member of the team, and I'll keep a few minutes as well at the end of my presentation to talk about the impact that Extra has had on my organization as a CEO. To begin with, I would say that initially we hesitated. We read, we met other teams because our challenge was to determine if it was worth our while in terms of time and financial commitment. And in fact, we did apply, and our project is well seated in Quebec. You may be aware that we have a shortage of support staff in long-term care facilities. And we were wondering if the choice of our project was what Extra was looking for. In fact, we applied, and our team was quite new and multidisciplinary. Myself as a CEO, but also we had someone who's in charge of research, somebody who's in charge of logistics, and someone who directly looks after an acute care program for the elderly. So our team felt it was a little odd, perhaps a little different from other teams, but I can tell you that this turned out to be a strength. It's a strength of the Extra program because, in fact, the variety of ideas, the variety of backgrounds help us see things in a more exhaustive way, a more comprehensive way. What's clear, I would add, is that we bought in, and we do have in-person meetings. For example, we met in Toronto in June. We spent a full week together in August in Tremblant, and I can tell you it's very intense. These residency sessions are a lot of work. Our days are fully filled, but they're very structured as well. And I would also say that I'm a senior leader who's done a lot of training, and I have to be faced with a lot to be impressed. And I can tell you that that was one of my one of my questions at the outset. Is it going to be worth it? And I can tell you, after 6 months of intensive work, yes, I'm very much stimulated, and I'm still learning. And what I'm learning also at the end of the day is what are the major trends in today's and tomorrow's world of healthcare. Talking about the past as a CEO is not something I'm focused on. And I can tell you that with all the speakers and the faculty we've met at Extra, we can talk about the past sometimes, but generally we are focused on the future, and I can tell you that that's what pumped my team the most. And rather than think about a very simple or specific problem, we've been looking at things in a more holistic fashion. And I can tell you that it's been very interesting to look at projects from across Canada. And as leaders, we have to look at what's done elsewhere. We have to think differently, think outside the box. And that's what Extra helps us do. It's also being challenged in the project. As you know, the program provides coaching, provides expert faculty, and they're very accessible. And their goal is truly to challenge us, to make us challenge the status quo. And I can tell you that our project has evolved for the better. And through these questions, through these challenges, we've gained a lot of knowledge, and I can tell you that without that support, the project would have taken a different turn, which would have had an impact on its success. And this is something that's very interesting, especially if you're a senior leader. Having that type of training is very hard to access. It's unique to CFHI and Extra. I can tell you that the training model that's very different because, once again, we work through webinars and through in-person residency sessions, follow-up calls, and we can have direct interaction with CFHI faculty and staff. All of that helps. I can tell you having that support, that access, is out of the ordinary. We know that every team works differently. We work mainly at night. That's the model we've used, and our coach is available in the evenings if that's what we need. So it shows you just how flexible these tremendous professionals are. Now, another thing that's important is the network. Jen spoke to this earlier. The networking possibilities are extraordinary. We have colleagues from BC, from Quebec, from Ontario in our cohort, and I can tell you, we share a lot about our projects. And already I had the opportunity to meet other people about other topics. So it does create a pan-Canadian network, and this can't be underestimated. It's something that allows us to meet people, high caliber people, because if they've been picked, they're high quality leaders, and this allows us to exchange and to address other issues, because as you know, in the Canadian context, whether you're from one province or another, it is important to keep improving, and it's important to look at how things are done elsewhere, and that, to me, is a tremendous gain. Now, as far as the challenges go, you need rigor, time. It's true. We can't overstate this. However, that's how things should be done when they're important. Now, you'll need to invest time and energy in preparing for the project, but I can tell you that it will pay off. All the projects you'll be working on will benefit from your participation in Extra, and your colleagues will turn to you. That's what I'm living now. That's what I'm experiencing now. A lot of people are curious. Other senior leaders are curious about my participation in Extra, and I can tell you that people within our organization are interested in applying and will probably be part of cohort 14 or 15 if they're lucky enough to be selected. Now, I would also say that as a member of the team, you have to have fun. We talked about rigor and intense sessions, but I can tell you that over the past 2 sessions, 2 in-person residency sessions in Toronto and in Mont Tremblant, we also had fun. And so it is possible to combine work and fun, which is also good news. We're all trying to meet the same challenges. We're all leaders in the healthcare system, and within our roles, we all share something fundamental. It's a lot of challenges, a lot on our plates, and I can tell you that that's another gain, something that unites us, and we appreciate it. Now, everything we learn, everything we do within a practical project leads to improvement, quality improvement. Really, they're best practices. Every cohort evolves as it goes through the Extra program. What cohort 13 is experiencing will probably be different from what cohort 14 will experience. And all I can tell you is you'll be exposed to best practices, and that's something you can't find elsewhere. So it's a program that's aging well, because it's not aging. It's always evolving and staying current. So as a member of an Extra team, obviously I would encourage you, if you're looking for an up-to-date training that's a quality type of training that will challenge you, it's not going to be some sort of diploma you'll get just by being present. No, it's something that you'll have to invest in, and it will help you see things differently. And if that's what you're after, I have no trouble recommending your application to Extra. As I said, I'm the CEO of my organization, and yes, it's a financial investment. You know, budgets are tight, and that's something we had to struggle with. Was our organization ready to fund our team so that they could take part in Extra? And I can tell you right now that it's been a great investment. Our leadership team just through their interest, their curiosity, I can tell you it's paying off. We're not even done yet, but I can already see a change. Not a 180-degree change. You know, we're all trying to improve, but I can tell you that I can already see that people are thinking differently. They're thinking about focusing everything on the patient, and that's at the heart of every reform in this country, especially here in Quebec, and in our project, and in every part of the extra training so far. It has focused on the patient. The patient is always at the center of all our efforts, and I can tell you as a CEO, it's quite a shift compared to the past. The patient-centered approach is something that we're happy to see, and this is one thing that I would reiterate. You're with Extra, you have a better quality program, better quality training, and I can't see an equivalent anywhere. It's not that I haven't looked. We're always looking to improve our knowledge, but I can tell you after 6 months, my goal has been achieved, and we still have at least 6 months to go before we graduate. And I'm very happy that I still have those 6 months to go. So once again, I hope my insights are useful to you. And if you do choose to move forward with an application, you'll have made a good choice. And that's it for my presentation. Thank you.
Thank you so much, Danielle. I'm now going to pass the microphone to Patty O'Connor, our Curriculum and Faculty Coordinator, to tell you a little bit about our faculty and coaching support, as well as the curriculum that will be delivered. Over to you, Patty.
Thanks very much, Jessie, and thank you so much to Jen and to Danielle for describing what motivated them to undertake the extra program, and certainly for Jen, who has completed the program, what she's been able to gain from that. So bravo to both those participants, those former fellows and current fellows. Danielle is current. Extra is underpinned by CFHI 6 levers for accelerating healthcare improvement. These are promoting evidence-informed decision-making, engaging frontline managers and providers in creating an improvement culture, focusing on population health needs, engaging patients and families as partners in care, building organizational capacity for change and improvement, and creating supportive policies. A requirement of this program, actually, is that patients are invited as partners in the initiative, and we're recommending that there are a minimum of 2 patient partners who join your team. Throughout the 14 months of the program, you'll be exposed to a number of healthcare improvement frameworks and learn which is most suitable to you to use according to the aim and the phase of the improvement initiative. Some of the frameworks introduced include the Model for Improvement, the Institute for Healthcare Improvement's Triple AIM program, the National Health Service, the NHS from the United Kingdom, their change model and their sustainability model, the highly adoptable improvement model that was developed by a CFHI Harkness Fellow who is part of our faculty, and that's Chris Hayes, and the LEADS framework. Next slide, please. Next slide, yeah, thank you. Modules, the first slide, this slide here shows modules 1 and 2. There are basically 4 residency sessions in the program. The first module begins when you're accepted into the program, and one of the very first activities that occurs is the site visit. And then there is a residency session that occurs in June, and that will be in Toronto next year as it was this past year. The focus of Module 1 is on building organizational and team readiness and designing the improvement project. So in addition to the site visit that you'll have with your coach, with your CEO and your executive team and the project team, there is also the residency program and webinars that you will have in Module 1. Then Module 2 is a 1-week residency session in August, and that is going to, actually, I'm not sure where it's going to be. This year it was at Mont Tremblant, and the focus of the second module is really on taking a deeper dive into refining the improvement project. So it's a very intensive week, and where you get a lot of feedback on your aim statement, your driver diagram, the measures that you're selecting, and really trying to tighten that whole proposal before you start the implementation. The other key focus in Module 2 is on enhancing your leadership competencies, and there are quite a few different guest faculty who address that. Module 3 then follows immediately after that August residency session, and right now actually the teams are in Module 3, and that continues on until February. And Module 3 is really the period of implementation. So it's around implementation, accelerating your progress, and addressing the various challenges and barriers that you may encounter. There are no residency sessions during Module 3. It is all virtual, and there are webinars and affinity calls that occur during that period. And Module 4 occurs in February, and the focus is on planning for sustainability and spread and for sharing your results. That this year, with the current program, this cohort is going to have their 4th residency session in Banff. So as you heard from Danielle and from Jen, we sort of move back and forth across the country, and it gives you an opportunity to learn about different parts of Canada at the same time. And then the very final session is the wrap-up and reporting out residency session, and that will occur in June 2019, and the team will be accompanied by your CEO. Extra training is delivered through 4 interactive modules that I've just described that provide a balance of theory, improvement science, and other methods and tools, and are delivered in in-person residency sessions, a series of interactive webinars spread across the 14 months, and an online learning platform. Teams will be notified in April of their acceptance, and then site visits occur in May. The first residency session occurs, as I mentioned, in June, and is followed by residencies in August, February, and then in June 2019 for that final reporting. Next slide, please. CSHI faculty are renowned Canadian and international experts and organizational leaders. A number of us are also former fellows from the Extra program and from CSHI's Harkness program. The faculty members advise CSHI on program design and curriculum development. We deliver the curriculum to fellows throughout the program, and we provide guidance and consultations to teams during the residency sessions on the design, implementation, and evaluation of your intervention project. Next slide, please. In addition, each team has a dedicated coach who supports them throughout the 14 months, a unique feature of this program. CFHI coaches are senior health system leaders selected for their knowledge and experience in leading system change and improvement initiatives. The coaches understand the regions in which the teams are located and the complexities of leading change in dynamic organizations. Most of these coaches are former chief executive officers. They help teams anticipate and navigate challenges and provide insight regarding strategies to gain momentum and support for their intervention project. The coaches conduct in-person site visits at the outset of the program to meet with the CEO, your senior management team, and the extra fellows. And the coaches have monthly touch-base meetings with each team by video or teleconferencing. They hold periodic meetings with the CEO and or senior management from your organization. And they also provide office hours during residency sessions, interactive webinars, and via the online learning platform. And now over to you, Jessie.
Thank you, Patty, for outlining the curriculum, coaching, and faculty support for the program. And now a little bit more information about the extra application process. I would encourage you, while I'm working through this next section of our presentation, to share any questions or comments that you have for Jen, Danielle, or Patty using the chat pod on the right side of your screen, and we'll address these shortly. So Extra is for organizations who want to build improvement capacity, enhance leadership skills, and create partnerships across regions and sectors to address priority health or healthcare issues. Teams can be from a single organization or several who want to work collaboratively to improve health service design, delivery, or policy. Teams are comprised of 3 or 4 fellows, and organizations outside of Canada are welcome to apply. We're looking for fellows that have a significant scope of authority and responsibility and influence within their organizations. And there are a variety of roles that are part of this, and they're outlined fairly clearly in our prospectus. Our improvement teams must have access to strategic advice and guidance from key leaders, including a minimum of 2 patient advisors. Include as a member of the team or appropriately engage clinicians, providers, and patients and families, and then have access to performance measurement, evaluation, and project management support. Leadership for strategic and senior leadership at the organization is key to moving forward the improvement project that you'll be working on. And so we look to, one of the roles is the senior leadership support role, and that the senior leader will provide strategic advice and guidance related to leadership and change management, actively participate in the organizational assessment site visits, reporting webinars, and attend the final residency presentations in June 2019, and ensure that fellows have protected time to work and resources required to successfully lead the improvement project. Improvement projects are focused on real-life health system solutions. And so here are some of the domains of quality and areas where we see improvement projects taking place to address issues within the health system. They should align with your organization's strategic priorities, quality and performance improvement goals, and plans, and team members' responsibilities. Improvement projects can address the needs of a target population, design a new product, process, or service, improve an existing process or service, spread a promising practice, develop a framework or infrastructure for improved governance, management, or quality. Also, some of our more recent extra teams are looking at developing health systems plans in response to issues that reflect the realities of implementation the realities of actually implementing within their own context. So this is really a systems look and an on-the-ground solution to improvement. CFHI strongly encourages organizations interested in applying to have a 30-minute call with an experienced CFHI coach prior to submitting their application. The coach will provide potential fellows, organizations, and CEOs with guidance on scoping and framing the improvement project, assembling the right team, and other key elements of the application. There's no fee associated with this call, and we have information at the bottom on how you can request a call with one of our improvement coaches. Our applications are due February 14th, 2018 at 8:49 p.m. Eastern Time. To request an application, just email us at extra-folks@cfhi-fcas.ca. And a little bit about our merit review. CFHI do a screening of the applications received for eligibility. The Extra Advisory Committee then convenes to review the applications, and organizations are notified in April of the outcome of the merit review. A detailed description of the selection criteria used by reviewers is available in the prospectus, which is on our website and available through the links that you have there. As mentioned previously, the cost of participating in the Extra program is significantly subsidized by CFHI as part of our commitment to working together to make change happen. CFHI covers the costs of travel, accommodation, and 2 meals per day at 4 in-person residency sessions. Additionally, fellows have access to CFHI faculty coaches in the online learning platform known as the CFHI Desktop, and successful applicants contribute a one-time fee of $5,000 per fellow. we recommend cost sharing where possible. So if you're looking at multiple organizations bringing in an application, or the organizations are encouraged to work together to share the cost of the extra program. Again, here are our key dates and milestones, and we've opened up the floor for your questions. I think we'll spend the remainder of our time answering questions and looking at the chat box. So if you have questions for one of our three speakers, we'll read them and we'll direct those. And in the meantime, we'll read out some of the questions we received and answer. So there have already been some requests for an electronic version of our presentation, and that will be made available at the end of the webinar. The information on the slides can also be found in our prospectus, which is available on our website. I don't think there are other questions right now. Patty's offered to answer any questions that our audience may have about the program and the supports that are provided for the extra program. And I think I'll leave the floor open. It looks like there's a few people who are typing right now, so we'll give you a minute, and then we'll move forward. So we have one question from from Victor at the Government of Nunavut, asking for a little more information about our organizational site visits that occur in May, and I'm going to ask Kristen to tell you a little bit about that.
So good question. So these organizational site visits, typically every team will be assigned a coach, and that coach as well as CFHI staff will attend, and your team would participate as well as your CEO, and we would look at your organization's readiness to participate in the program. We would review your application, identify good components of the application, strong components of the application, identify some weaknesses that we need to work on, and really scope down that project and ensure that you can implement that project within the 14 months of the program. So that's overall some of the things that we would do in that organizational site visit. What else can I say about that? But that's really the crux of it.
Jen has also added a comment which says the site visit is a great opportunity for a formal kickoff of the project with your CEO, leadership, and lots of chances for questions and answers to be addressed. I think the other opportunity that comes from that site visit is the opportunity for teams to understand what strengths and weaknesses have been identified perhaps by the merit review process, and areas where they may need additional coaching help, and then begin that conversation with your coach about those so that we're supporting you and moving forward with your improvement project. So we have a question from Noella, Kate, and Shauna, and their question is, does the improvement core team require a physician member? And the answer to that question, ladies, is that no, it does not require a physician member, but we would, depending on the improvement project that you're looking to do, you're very likely to have to engage with the physician group at your organization. And so it's really more access to advice from and development of your project plan with the physician groups within your organization. I'll give folks another couple of minutes to type in any questions that you might have. Patty added a comment about the extra program being a fantastic opportunity to gain major organizational attention and support to advance something that is really a priority within your organization. At this point, we're not seeing additional questions, but we invite you, anyone on the phone, if you have additional questions or that they come up as you're considering the extra opportunity, to feel free to reach out to us and send us your questions. And our team here at CFHI, as well as our coaches and faculty, would be happy to work with you, as we mentioned previously. I think that with that in mind, we'll move into our next section. So I'd like to thank all of our speakers for their excellent presentations today, and to you, our audience, for your participation. We hope this session has been helpful in explaining the nature of the extra program, and that the discussion will spark a dialogue within your organization about healthcare improvement and submitting an application to the program. Your feedback is appreciated, and please let us know through the poll on the screen if you're interested in submitting an application for the extra program, if you're interested in setting up a coaching call to learn more about the application process and requirements, if we can contact you to further discuss the extra program, and what other questions can we address for you that will help your organization to decide if extra is a good fit. Again, thank you to Jennifer, Danielle, and Patty for their excellent presentations, and of course to you, our audience, for joining us today. This concludes today's webinar, and we wish you a good day. Thank you.
Ladies and gentlemen, this does conclude the conference call for today. You may now disconnect your line and have a great day.